Hello everyone, it's Jessica Veloza and I am going to share my presentation with you guys. So I am going to share my screen right now and I am going to put this in the reading view. So my presentation is on the vagus nerve and mental health. And there's actually so many benefits of the vagus nerve stimulation that I had a hard time making this succinct. So I am going to move forward through this, but the contents of this presentation include, basically this is the outline of the instructions, but I'm going to introduce you to the vagus nerve and we're going to talk about a case study involving vagus nerve stimulation. And we're going to discuss treatment goals and lifestyle interventions. And then I'm going to reflect on strengths and weaknesses and how I would apply it in my practice. Sorry for the noise. So the vagus nerve, it's a mixed autonomic nerve originating in the medulla oblongata, and it projects from the brainstem bilaterally along the neck, and it goes to the gut, basically. So the vagus nerve stimulation dates back to the 1800s. It can be invasive or non-invasive. And both invasive and non-invasive have demonstrated promise in treating many things, many different psychiatric disorders, depression, difficult to treat depression, refractory depression, as well as multiple sclerosis, headaches, migraines, obesity, so many things, multiple sclerosis. There are so many things that have been connected to benefiting from vagal nerve stimulation. The anatomy of the vagus nerve. This is a nice simple picture. The most information about the anatomy of the vagus nerve and its projections have been discovered through studies on mice or rats. So there's still a lot of curiosity and mystery surrounding the vagus nerve and why we don't know everything. And a lot of people believe that it is the root of the part of the gut-brain connection, So this is just a simple diagram of the targets that the vagus nerve has interaction with, and I have more information, but it is the fifth cranial nerve or cranial nerve 10. And the vagus nerve is a major component of the autonomic nervous system. It's key to the maintenance of homeostasis within metabolic pathways, as well as the neuroendocrine immune axis. So the vagus nerve helps to maintain homeostasis throughout its afferent and efferent pathways, meaning it sends messages and it receives messages. It runs from the base of the brain, it branches down the neck, branches through the chest and stretching all the way down to the abdomen. Vagus actually means wandering in Latin, and it wanders down the body, touching the heart and all major organs on its way, like your lungs, liver. I have another diagram to come. It also affects your face, neck, ears, tongue. I even read somewhere that Darwin theorized that the vagus nerve was what allowed us to make connected the emotions to our facial expressions, but that it was never proven yet. It's kind of hard to study. The vagus, some things like this, human studies are hard to study. The vagus nerve is the part of the body that seems to explain how our minds control our bodies and how our bodies influence our minds. So again, a little bit repetitive, but I really like this diagram. It basically just shows you that the vagus nerve has afferent and efferent nerve connections with literally all of your organs. So, what has been researched and proven is probably just the tip of the iceberg. I'm going to show you a little video here. What is the vagus nerve? But I'm going to move it forward a little bit because it's a little bit long. So I'm going to talk about everything that that video talks about, and I don't want to take up too much time, so I'm going to move forward. What is the vagus nerve? Well, I've already talked about that. It's the longest nerve, cranial nerve in the body. It branches to all these different organs that are so important. It's the super highway of the nervous system, and it sends important communication between the brain and many parts of the body. Vagal dysfunction. So your vagus nerve plays a part in controlling voluntary, sensory, and motor functions like your heart rate, your speech, your mood, your urine output. It helps your body switch back and forth between your fight or fight response and your parasympathetic mode, where you're more relaxed. So if you can imagine, if you have vagal dysfunction, you can't relax. So it would make sense that vagal nerve stimulation would assist with stress-related neuropsychological disorders. So your vagal nerve can lose its ability to switch back and forth. And that's vagal dysfunction, and it can put you at risk for high blood pressure, heart disease, type 2 diabetes, depression, anxiety, among many other things. So I sort of zeroed in on treatment-resistant depression, which can be referred to as refractory depression, treatment-resistant depression, and difficult to treat depression in the research that I have found to include in this presentation. The case study reviewed in this presentation shares the story of a patient who had been suffering with treatment-resistant depression. Extensive research has been done regarding the effectiveness of vagus nerve stimulation in treatment-resistant depression. Major depression is one of the most common ailments, affecting about 18 million people in the United States. And that was from 2012. So I bet it's a lot more now. That number is probably not up to date. According to various sources, from 15 to 33% of major depression patients do not respond, again, to adequate treatments or current approaches to treatments of depression. Maybe that's more now too. Treatment-resistant depression is one of the most difficult problems encountered by clinicians. I can tell you this from experience as a nurse in the hospital. You can probably tell me this from experience personally or with one of your friends or family members. So here is we're moving into the case study. This is information from, so I used actually a case study that was not a patient or friend that I have seen or made up, because I found a very interesting case study to present to you. So in 2005, the vagus nerve stimulation was approved by the FDA. And I'm talking about an implantable device that is, it appears to be like a pacemaker. I have pictures later, but it is an implanted device that stimulates the vagus nerve. So it's invasive, and it is approved for difficult to treat depression, for epilepsy. I'll go into this more. More devices have come along, stroke patients, tinnitus, some really interesting stuff. So clinical trials are, we still need more, but a lot of good tolerability apparently in people that get these devices placed. Here is my case study. A 38-year-old woman suffered from severe major depression, general anxiety, borderline personality disorder, post-traumatic stress disorder with childhood sexual trauma, frequent pseudo seizures, and migraines since she was 20 years old. So that's 18 years. Probably her suffering started before that. She had been treated with fluoxetine, citalopram, standard and long acting. You see all these other medications. They have tried everything. None were effective. The sertraline alleviated her depression slightly, and she had also been treated 10 times with electroconvulsive therapy for that major depression, but did not respond well. She had 10 psychiatric admissions for severe depression with a suicidal attempt and suicidal ideation before 2005. So to paint a picture, this is the severity that you may have to present with in order to get approved for by your doctor, by your insurance company for one of these devices. In December of 2005, she underwent placement of a vagal nerve stimulator for her refractory depression. After the placement, she reported that her depression immediately got better, that she felt totally different. Since then, her mood has been stabilized and she has seldom experienced depression. That was these researchers' review of her case in 2012. So that was 7 years after initial placement of that stimulator. Her vagal nerve stimulator worked very well until 2011 when she had a thorough breast examination. She was palpated and massaged over the place where her vagal nerve stimulator was placed. It was in the left upper anterior chest. And since then, she had like this shock feeling going through her chest and arm. With involuntary muscle movements and extreme headaches, primarily in the left occipital nerve and in the left temporal auricular nerve areas. So her psychiatrist was concerned that one of the leads had displaced at that time, and these symptoms disappeared after the surgery frequency was decreased. So I didn't add the numbers. There's a lot of controversy in research about the numbers as far as the settings, but this case study wasn't supposed to be about this specifically, so I didn't go into detail about that. So over the 6 years since the stimulator was placed, she reported rarely feeling depressed, sometimes mildly depressed, but never suicidal ideation. Remember, she had been inpatient psychiatric unit 10 times, plus all the trial and error, the suffering, the back and forth with the meds. And I go into this, but that pathway that you see that she took is the conventional pathway that most patients who suffer depression or other psychiatric mental health disorders, that is a very common pathway that they take. It's a very common treatment that they receive when they are receiving care that is not lifestyle focused. So the vagal nerve stimulator reduced her anxiety levels, and she has had fewer pseudo seizures, and her sleep has improved. The only side effect is that sometimes the volume in her voice can increase or decrease, but she admits that it does not disturb her very much. So interesting, that side effect, because we'll go into this later, but one of the ways the powerful ways to stimulate the vagus nerve is singing, chanting, humming, gargling, stimulation here, and it goes right here. So like there's even, we'll see later, but there's like external stimulators that you can use on the vagus nerve. It's so cool. The only side effect is that sometimes the volume in her voice. So I read that. Currently, she feels normal and does not feel depressed. Her current medications are sertraline, 100 milligrams nightly for depression. So that's an SSRI. Topiramate, she's taking something for headache and seizure prevention, and then Ambien for sleep. So she still is using an adjuvant, like a concurrent medication treatment plan, but she is also using this vagal nerve stimulus. So the other reason I chose this case study is because and talked so much about the device is that it paints a picture of how powerful vagal nerve stimulation is. So I'm going to go into speaking a little bit about vagal nerve stimulation devices. Invasive vagal nerve stimulators are implantable devices as depicted here. Can I move this thing? FDA approved to treat epilepsy, refractory depression. So some of the side effects and health problems associated with implanted vagus nerve stimulation can include voice changes, as our patient discussed, hoarseness, throat pain, cough, headaches, shortness of breath, difficulty swallowing, tingling or prickling of the skin, probably from the nerves, from the electrical stimulation, insomnia, and worsening of sleep apnea. Though most patients report that they tolerate it well, and this information is from the Mayo Clinic. So there's your little, see, it's in the location and very similar looking to the pacemaker, to a cardiac pacemaker. And you can see the vagus nerve there in that picture, how it attaches to the vagus nerve and how it goes here. So vagal nerve, other type of vagal nerve stimulation devices. Again, this is too much information. You can look at it later, but this is this external one I was talking about. You hold it to your neck. It's for migraines, and it can be used to treat acute migraines or prevent future migraines. And it's not implanted. So that's the big cool thing about it. The Gamma Core is the brand of that. So, you know, if this is something that we could present to our patients and or clients. So other types of devices are on the market. And there are also this device, the micro transponder. This brand has two different devices. Oh my, sorry. And the complete, this one is, it's for stroke patients. So they implant the device and they use it in combination with like the therapist, and they use it to help improve hand instability after strokes, or like strength weakness after strokes. So I mean, just the it's pretty amazing how many different areas that it's been shown that vagal nerve stimulation can help. I didn't want to go into too much about this because, again, it's not the topic, but here's another device, the Serenity, that's also by the Microtransponder company, that can help with tinnitus. So this is, it's implanted, but it connects with this headphones that connects with the software. And you can read more about that if you're interested. So, current treatment approach, goals for depression, approach and goals. So this is actually from my nurse practitioner program, Family Practice Guidelines for Depression, in our practice guidelines book, the Cash, Glass, and Mullen book. So I'm not going to read through all of it, but I will point out that there are a lot of lifestyle focused interventions highlighted in this. And what I will also discuss is that on average, many offices that are not lifestyle medicine focused may give their patients a handout about this information. They may speak to their patients about this information briefly, but if you can imagine that most appointments are in the 15-minute range, they don't get integrated with their patients deeply. And this is a blanket statement, but the current treatment approach for most patients that interact with their family practice physician, or many, or even psychiatrists, is medication. in talk therapy. So we all suggest exercise, we all suggest sleep, but depressed, difficult to treat depression, tried a bunch of medications. This is so common. I hear it from so many friends, family, and patients. So, I mean, the research that supports the lifestyle medicine is so much stronger than the medication alone. So if you need the medication, you need the medication. Sure, there is a lot of effectiveness there, but doing them together. So it is the guidelines. It is what the family practice guidelines say. It is the treatment for depression. But, and again, I didn't go into the DSM-5, but lifestyle medicine is so powerful. So to zoom back into the presentation topic, treatment-resistant depression is what I focused in on. Refractory or treatment-resistant depression is the chief complaint of the woman in this case study, the topic that we will now explore more in relation to the vagus nerve stimulation. We have established that invasive vagal nerve stimulation devices are available and approved for use on treatment-resistant depression. The pathway that got these devices approved was the discovery and exploration of the fact that the vagal nerve stimulation itself, the action of vagal nerve stimulation, is helpful in resolving these problems and reducing the suffering in those experiencing this treatment-resistant depression or difficult to treat or refractory depression. Depression is the leading cause of global burden of disease, estimated to affect over 350 million people worldwide. That's a more up-to-date 2020. Again, it's probably increased since then, knowing the state of our world. But treatment-resistant depression is a serious chronic condition, disabling patients functionally and cognitively. Chronic vagus nerve stimulation is recognized for the management of treatment-resistant depression. In addition to classic clinical symptoms, it is now widely recognized that major depressive disorder is also characterized by significant cognitive impairment. These impairments are observed in different cognitive domains: memory, attention, and general psychomotor. So these cognitive difficulties that come with depression are also they respond very well to vagal nerve stimulation. 94% of them say that they have these cognitive problems. And so cognitive dysfunction, it affects your quality of life, it affects your daily activities, your relationships, your productivity at work. And not many just medications alone help them much. So some do, but electroconvulsive therapy is commonly known for actually causing negative cognitive adverse effects. So the rationale for investigating vagus nerve stimulation is to treat that depression. And there's a lot of preclinical and clinical studies. So a lot of research needs to be done. We are using a lot of animal models, but it's just difficult to research. So the vagus nerve has direct and indirect connections to emotional and cognitive functions relative to depression. And animal studies have shown that the vagal nerve stimulation influences the activity of many of those neurotransmitters that are implicated in mood disorders. So I'm going to go into reflection, implementation challenges. Vagus nerve stimulation is proven to be effective as a treatment option for difficult to treat depression. I have said it, I have made that very clear. However, there are a lot of challenges. If you're doing the implantation, it's expensive, it's complicated, it requires a lot of support and resources. You have to have a doctor that does it. You have to have a doctor to refer you. It's invasive and it's difficult to get approved for based off of what you've already been through and your insurance company. So that talks about that basically there. So practice application. The ways in which I would apply the practice of vagus nerve stimulation in my practice and the approach to treating depression in general would be through education and guidance. The first line implementation of vagal nerve stimulation is non-invasive techniques. We can start this way before somebody has gone through years, 18 years of difficult to treat depression. Effective application in patient care requires education and guidance. So challenges, again, to this in a regular practice setting are continuing education and guidance require more longer visits with patients, and lifestyle-focused practice approaches will prioritize this in order to be effective. So the average office might not be able to do this as much if they don't have time to spend with their patients. Again, application challenges, devices, I've already basically discussed this, but we could implement this before we go through all this. Non-invasive vagus nerve stimulation. Meditation slows your breathing, slows your heart rate. Extended exhalation. They talk about this all over the place. It can regulate your autonomic nervous system. Yoga can also, with a focus on breathing, extend your exhalation, which stimulates your vagus nerve. Exercise, interval and endurance training can increase your vagal nerve activity and improve your heart rate variability. Massage can increase your vagal tone and even decrease blood pressure. Music, I spoke about this. Singing, vocal cords, the muscles at the back of your throat, they pass through your inner ear. Singing, chanting, gargling, all of those things stimulate your vagal nerve. And cold water immersion. There's a lot of information out there about this. Look up the Wim Hof, WIMHOF method. Cold water immersion is shown to stimulate your vagal nerve, increase your immune system, decrease your metabolic demand, a lot of things. So research shows that cold water immersion can help with stress by slowing your heart rate and redirecting blood flow to your brain. Try placing an ice pack on your face or neck or taking a cold shower. This is all from Cleveland Clinic. More benefits of stimulating your vagus nerve. Minimize seizures with epilepsy, treats depression, regulates your emotion, reduces blood pressure, lowers your heart rate, reduces inflammation, treats migraines and cluster headaches. Your vagus nerve plays a powerful role in your body. Keeping your vagus nerve strong and balanced can help you respond more effectively to a variety of emotional and psychological symptoms. So, I'm not going to read this in detail, but this repeats much of what I just said. You can read it on your own. We don't always have to let stressful situations negatively control our minds and bodies. We can stimulate our vagus nerve to send a message to our bodies that it's time to relax and de-stress, which leads to long-term improvements in mood, pain management, well-being, resilience, health, and wellness in general. So I'm gonna go ahead and sign off now and say thank you. I did get this slide plan from Slides to Go, the design. So thank you guys so much and have a good day. And thank you for listening to my, my presentation here. I'm gonna stop recording now. Bye.